Hello everyone, my name is Richard Gentry, President and Founder of RG Strategic Interventions LLC. It is indeed an honor and a privilege to come before you again to share some information that I feel is vital when it comes to working with young people, whether that's in the academic setting or in the detention environment or in residential facilities or in community-based settings. The information that I have for you in this presentation, I'm sure you will find extremely beneficial. A lot of the information that I have has emerged over recent history in regards to our understanding of the brain in neuroscience. In my last presentation, I talked about the physiological effects of trauma, especially when you're dealing with the inner city youth and the backdrop of the violence and the calamities that tend to happen with inner city living and living in poverty. Trauma results from childhood abuse, neglect, human trafficking, assaults, rape, witnessing violent events, house fires, etc., etc. For many people, natural disasters such as hurricanes and earthquakes and tornadoes and the devastation that results from that also brings forth traumatic situations. When we talk about young people in out-of-home placement settings like detention and in residential, many of them have experienced extreme trauma. And we need to understand how to work with these young people. Oftentimes, trauma has been viewed as the elephant in the room. We've worked with these kids in so many different ways and aspects in regards to interventions and approaches that we felt at the time would be beneficial. But we have information now that working with traumatized kids is paramount. And in my facility and in my circles, we take the approach that pretty much 100% of the young people that we work with have been traumatized in some way. Many of them are coming from these communities where their primary caregivers have been faulty. Many of these young people have been raised on the streets. Many of them have dealt with extreme neglect. Those primary caregivers have been the primary source of inflicting pain and harm to them that caused them to be very dysfunctional in the way they behave and the way they see the world. So with that being said, we now know that many of the behaviors are not necessarily the result of moral failings or signs of a lack of willpower or bad character. Many of these behaviors are actually caused by changes in the brain structure. In the previous presentation, I talked about behaviors as not necessarily being a choice. And in cognitive behavioral therapy, primarily that's what we teach, is that behaviors are a choice. But we know now that that is not necessarily the case because of the impact of trauma and how trauma has not only changed people in a psychological and an emotional way, but also in a physiological way, that the actual biology of an individual changes as a result of trauma. And when we talk trauma, we're not only talking about changes in the brain structure, but trauma affects the entire body. So the interventions that we have to apply have to not only be interventions that deal with the brain, but also the rest of the body as well. So we're going to talk a little bit about that. About 500,000 of children in the U.S. take antipsychotic drugs. Many of these children come from lower income families, fueled by Medicaid insurance. And we have learned that these kids are 4 times as likely to receive these antipsychotic medications to stabilize them as compared to those children who are privately insured. And so many of these kids from low-income families are entering the juvenile justice system and the child welfare system, and we have direct contact with these kids in regards to trying to make them whole, if you will. For these young people, what they suffer in regards of trauma, the minor frustrations that they encounter can cause extreme rage in them. Trauma victims are sensitive to threat. We have to understand that. So if any situation that's posing a threat, oftentimes we tend to get extreme responses or extreme reactions from these individuals. Also, it's important to note that these individuals find it very difficult to form intimate relationships or positive relationships because oftentimes the source of their trauma has been caregivers. The source of their trauma has been individuals. So maybe they've been harmed by someone, and in return, they have harmed someone else. So they find it very difficult to trust someone with their feelings and emotions. And they also feel very uncomfortable that someone should trust them with feelings and emotions because of things they have done as a result of their trauma. So victims of trauma see the world very different than those people who have not experienced trauma. I'll give you an example. For the average person, if someone's walking down the street, on a nice day, they may just see that person is walking down the street to get some air and enjoying some leisurely time, of some exercise or something like that. But then take a person who had been viciously raped and traumatized. If that person who experienced a rape and extreme trauma see that same individual walking down the street, their experience will be very different. They would see that person as possibly a perp, and maybe this person is looking to victimize them in some kind of a way, which may cause some kind of a trauma response or reaction from them where they become filled with anxiety and rage and fear and all of these kind of things. So what we do know about trauma is that it impacts people in an adverse way. For the most part, it will not go away. We have information as to how trauma is stored in that deep primitive portion of the brain or the right brain. We'll get into that a little bit further. But it is so much to learn about trauma, and we're only scratching the surface. And as I mentioned before, by no means am I an expert, but I do make every attempt to learn as much as I can about the brain and how trauma impacts the brain, because in our facilities, trauma tends to show its ugly head in many forms and in shapes and through many experiences with our young people. So it's so important for us to understand how trauma impacts individuals. Now, when it comes to working with kids in our facilities or kids in community-based settings who have experienced trauma, trauma therapists will tell us that primarily they use 3 different approaches in working with them. And I just briefly want to touch on these different approaches when it comes to working with victims of trauma. The first approach, briefly, is a top-down approach. And what I mean by that is when we talk top-down, we're talking about the talk therapies and the Freudian concepts or the Freudian philosophies tend to take precedent when it comes to talk therapy. But basically, the goal with talk therapy is to allow the patient or the victim or the youth to understand what is going on in their bodies while processing those horrid memories of trauma of the past. So the more they can understand what happened to them in times past and why they respond the way they do, the better they'll be able to connect with the here and now and begin to make some strides to be able to separate the trauma of yesteryear with the realities of today. And as we know it, that when these trauma responses happens, certain things occur within the brain, whereas those memories and those experiences begin to come to life again. And because the left brain or the rationale portion, or how we reason or logically figure things out, because that portion of our brain tends to shut down, we can't make sense of the experience or the time lapse from maybe many years ago and compare it to the here and now. So they are experiencing an event maybe 13 years ago, if it's an older person, or maybe several years ago, if it's a younger person, as if it's happening in the here and now. So education and talk therapy tends to be helpful. The second approach is medication. So when we talk about pharmacology and the onset of these types of drugs that treat people with trauma, we have found that we have begun to gain increasingly more and more successful results as to the onset of these various psychotropic drugs came to the scene. Some of the more familiar antidepressants or psychotropics that we tend to see with our young people are Zoloft, Seroquel, Risperdal. Those are some of the more popular medications that are used. And finally, the third approach I want to talk about is the bottom-up approach. And this is where the body is allowed to have experiences, or we present situations and circumstances where the body can have certain experiences that contradict the helplessness and the rage that comes from trauma. So in essence, an approach is made where people are able to experience physical sensations or physical type interventions that will benefit them and counteract the unfortunate and the helplessness and rage that has occurred from trauma, which is a bodily experience from yesterday. So those are the three interventions that many therapists use. And what I really want to focus on in juvenile justice and child welfare, we can do certain things, although we are not therapists. It's good to know what therapists do. And so I want to talk a little bit more about number three, the bottom-up approach, where we can introduce certain interventions where the body can have certain experiences to alleviate the harmful effects of trauma and the memories thereof, which exhibit itself through the senses. And there's certain bodily sensations that happen that make those trauma experiences from the past seem as though it's happening again, because the deep portion of the brain, the right brain, is very hard or difficult or impossible to be able to sort out the experience based on a timeline, especially if the left brain tends to shut down. So some of the interventions that we have used in regards to this bottom-up approach to working with kids who have been traumatized are mindfulness and meditation, yoga. Sensory objects work really well, such as stress balls, play sand, and kinetic sand. We use aromatherapy, essential oils, therapy dogs, weighted blankets, music, art, poetry, painting, gardening, and theater, which is not an all-inclusive list, but it will give you an idea of some things that you can do in regards to interventions that can be very helpful with these young people. Some of you may not know that I operate a detention center during the daytime. And one of the things we have done is a short-term high secure facility for juveniles. One of the things we have done is implemented most of these interventions, if not all of them, that I've talked about, and we have implemented them with great success. So one of the things that we want to do through these interventions is just help kids to find some sense of normalcy and to relieve the anxiety, and that they can find a great degree of regulation through these types of interventions, whereas they can sleep better at night and function during the daytime. So there are lots of benefits to some of these interventions. For instance, I'll talk a little bit about yoga. We were very hesitant about yoga and how delinquent youth would respond to a yoga program. But we provided them education. We brought very competent people in to teach yoga. Our staff understands yoga. They have studied yoga. And once we have developed an understanding of it and what it could do, we've implemented it into our facility, and we have experienced success with it. And the kids have, our young people have been great in latching on to it once, the novelty of it kind of went away and they realized that it's just a part of our program. They really begin to get into it and experience the benefits of a yoga program. And some of the benefits that we find are better coping skills, healthier relationships. Yoga tends to increased stress and anxiety, increased emotional regulation, and increased neurological as well as physical health. And also, it helps to recognize the emotions and feelings within the body. So we are strong advocates of emotional regulation techniques, and we see it just as important as cognitive behavioral intervention, because keep in mind, most of these kids have been damaged. They've been traumatized in some way. They don't understand it. Many of them do not understand why they act and respond the way they do. They may not be able to recall the experience because the experience isn't a cognitive experience. It's very confusing to them. But we often see the symptoms. We see the signs of those who have been traumatized. We recognize that they have had some kind of an unfortunate experience in the past. And so as a general approach in our facility, we tend to use these many interventions to bring forth a degree of regulation so they can function better. So we're better able to teach them. So they are better able to respond to structure. So they can follow programming. They can receive simple redirects better. We can teach them pro-social skills. These kind of things that we find very important in our facilities. So we want to give you just a little bit more information as a follow-up to our previous presentation in regards to trauma. And so again, I ask you to use the Berean approach, meaning that as you hear this information, go home and do your research. Google some other terms, get you some books, go online, and research and study the brain and the effects of trauma. And I believe things will come together for you all the more. So I want to thank you for tuning in. If you have tuned in through my website at www.rgstrategicinterventions.com, we want to thank you for that. And if you logged in through YouTube as well, my YouTube viewers, thank you so much for tuning in. And until next time, we will see you.